The femur, also known as the thigh bone. You are looking at a right femur from an anterior view. This end is superior, or the proximal end. This end is the inferior end, or distal end of the bone. This would be the medial side of the bone, and this would be the lateral side of the bone. Landmarks you can identify from the anterior view. First landmark is the head. On the head, you have an indentation called the fovea capitis. Next landmark is the neck. Next landmark is the greater trochanter, the lesser trochanter, the shaft, the patellar surfaces, the medial condyle, and on the medial condyle you have a little bump called the medial epicondyle, and then you have the lateral condyle, and on the lateral condyle you have a tiny little bump called the lateral epicondyle. The posterior view of the femur. On the posterior view of the femur, the landmarks that you should be able to identify are the head, and on the head you have this indentation called the fovea capitis. Below the head is the neck, the greater trochanter, the lesser trochanter, the intertrochanteric line, the rough surface called the gluteal tuberosity, this line on the back of the femur called the linea aspera, the articular surfaces for the tibia, the medial condyle, and the bump on the medial condyle called the medial epicondyle, the lateral condyle, and the bump on the lateral condyle called the lateral epicondyle.